A new study finds people with Down syndrome are at an increased risk of the COVID-19 virus. A recent study found with COVID-19, the death rate of people with Down syndrome over the age of 40 is 3 times higher than the general population. One of the doctors who participated in that study joins us now from Rome, Dr. Angelo Carfi, Geriatric Doctor at the Gemelli University Hospital. Doctor, welcome. Thank you so much for joining us. So tell us more about what you found in your study on people with Down syndrome with COVID-19.
So the main result of this study is that people with Down syndrome are at increased risk for adverse clinical events when infected with SARS-CoV-2, and especially those with age over 40 years, and also some comorbidities like obesity and cognitive decline. So we should be really careful with these persons.
Do we know why there is that correlation with those with Down syndrome and COVID-19?
We have a hypothesis, and these are based mostly on the peculiar immune system and reactions of people with Down syndrome, and so this is probably the reason why they behave this way when infected with the SARS-CoV-2, and then there are also there is the clinical complexity, which is characteristic of the adults and the elders with Down syndrome, which makes them very fragile patients to be dealt with.
Can you talk about maybe some of the challenges in protecting people with disabilities?
So I think they share the same challenges we'll all have. So the most challenging aspect to me is the isolation. So this pandemic forced every one of us to face a certain degree of isolation from usual contacts and withdrawal of favorite activities. And people with Down syndrome, people with intellectual disability, strongly rely on these things, on the contacts, on the usual behaviors, and so they are bearing a very heavy burden just for the isolation, and this burden multiplies incredibly when they get infected and they have to really isolate from everybody, and even more if they need to be admitted at the hospital. So this is I think the most challenging part, both for the patient, the families and the loved ones, and also for the clinician who take care of them.
Dr. Carfi, what else can you tell us about this study? Any other findings that came out of it that would be of interest to our viewers?
Now we have vaccines, and this is a really great opportunity. In many countries, people with Down syndrome have been prioritized to get the vaccine first, and this is a really important opportunity because for what I said before, this can help to break the cage and to go back to resume some of favorite activities, to get in connection with other people.
And we always like that good news. Thank you so much. Dr. Angelo Carfi, Geriatric Doctor at the Gemelli University Hospital in Rome. Thank you again, Doctor.
Thank you very much.